Hi, I'm Friba Faqeeri, the site medical director at our Columbia office. I have been with Chase Brexton going on 14 years.
I'm Sebastian Ruhs. I'm the Chief Medical Officer here at Chase, and I've been with the organization going on 13 years.
What I enjoy most about my colleagues is the strong sense of collaboration and teamwork. I value learning from them, and whether that is discussing complex cases or going over new research or guidelines, or simply just helping each other through hard days, being available to be a listening ear for and provides the space and time for colleagues to vent or share their feedback, concerns. This is mutually appreciated by both sides. With my patients, I enjoy building good relationship based on sympathy, empathy. Every interaction and opportunity is a learning for me and for them, for me to listen to them, to educate them, to make a difference in their lives. And then seeing my patients recover or manage their chronic conditions successfully is really gratifying. I have been fortunate to have been seeing my patients for a long time and have been in their lives, and I've seen them through trials and tribulations, and this has allowed me to again build great relationships. My patients are happy. They tell me when they look forward to our visits.
I enjoy the most being in an environment where we're surrounded by people who all have one thing in mind, which is serving our mission, serving our community, and being able to provide healthcare to everyone, independent from who they are or what their financial background is.
What excites me about my work is the passion of helping my clinical team and fostering again a culture of collaboration. I enjoy working with the various departments and giving any input that I may have on new projects, workflows that we come up with, and making our clinics more efficient and helping our staff have a better work-life balance. Healthcare is always changing with new guidelines and policies. This keeps me engaged and on my toes. I have to keep learning and making sure that I know my information so I could be a good resource for my team. Having a diverse patient population and learning about different cultures and building long-term relationship with patients again is very energizing about my job. And I'm again motivated by the people I work with, the clinicians, the support staff, the nurses who show up every day and take good care of our patients. My role here is to help them make the days as successful as possible and removing the barriers that I can control. And every day is a challenge, and I never have, I feel like, a boring day at work.
What excites me the most is being able to give back to the community, being able to provide care to every patient, independent from who they are, what their background is. We welcome everyone, and that also reflects here in the work environment. The staff is outstanding. There's a great collaborative vibe whenever walking around in the clinics, and you can really feel that everyone is here for the same thing. There's a couple of great memories that are coming to mind throughout these 12 years. One is that I will never forget is having started my first transgender patient on hormones, and the great experience that person had during the first couple of months in that transition. I'll never forget a young person who came here for as a new HIV diagnosis, and we started them on treatment and provided feedback and care. And when that person came back and said, "I can live with self-esteem and happiness," that is also something I will never forget. And these are kind of the moments that keep you going in a work environment. Not every day is a Sunday, as my grandmother used to say. And but these are the memories that make this organization very unique.
I would say one of the great changes that has happened since I've been here is our growth. When I started, our provider team was very small and we knew each other by name and face. We used to hold regular in-person provider meetings, but with COVID and because of the sheer size of our clinical team that has grown, we've not been able to continue this. But we do have our annual provider appreciation dinner, which gives all the clinicians an opportunity to come together and catch up. We used to hold an all-staff retreat, which was fun and engaging, but again, because of the sheer size, this is not possible anymore. We have added great services like our diabetes management program, podiatry, nutritionist, OBGYN at Columbia office, which we never had before. And we have a lot more services that were added to our Mount Vernon site as well. Our mission has stayed the same, and we're still the place to go to for all our patients in the community. From what I hear from our other clinics in Howard County, Chase Brexton has the best wraparound services, and it is a lifeline for our local hospital here.
Yeah, I was going to say the same. When I started, we were about half the size from what we are today. We didn't have the Glen Burnie office, and our Randallstown office was still open. We haven't moved into the Security Square. We're much larger now, but the thing that hasn't changed is the collegiality, the friendliness of the staff, and the great teamwork among all the parties.
I would tell them that they have come to the right place for building on their skill sets that they've already learned, working with a wonderful team of clinicians, and that they have always have an opportunity for continuous learning with all the different diagnoses and cases that they will see here. There will be days that are very stressful, but these days are offset by the gratitude the patients show and how they make them feel at the end of the day after a stressful day. You'll never be bored. I would tell them with what you have to do and the opportunities you have to contribute in different ways, like being a part of our clinical improvement charter groups or going out in the community with the fun activities that the marketing team plans and our case management team puts out. So I would say they have chosen the right place to be.
Advice is hard to say. I don't know that I have necessarily advice for anyone starting here. I agree with Friba. I would welcome them warmly, and I always share the amount of years that I've been here. That speaks for itself. So I've been here very happy, very grateful that I'm able to work in a place like this where I can be myself. And if there's some advice, then maybe that's what I can share. You don't need to hide yourself here. You can be who you are.
I said my hope for Chase Brexton was to continue to grow. I hear from my patients that come from like far away that they hope that they had a Chase Brexton near them. Hopefully we can fulfill this wish by opening more offices where we can and financially able to. I hope that we continue to do well and become the center of excellence for all of our service lines, and for the staff to be proud of the work that they're doing and call Chase Brexton their long-term home.
What do I hope? Hoping is maybe not the right word, because I know we will remain true to our mission, and I know that we will remain true to who we are. Hoping, similar to Friba, that we can reach even more people than we already can in our community and be able to serve more communities.
I said blue. I love the color blue.